Here is your question. Right. So if you have read and understood, considering its surgical and administration, kindly please tell me if you can identify in picture A, what are these arrows? What can you see? What are these?
These are possibly diploid veins, ma'am.
Yes, what are diploid veins?
Diploid veins are veins in the diploid space of skull
Yes,
and drains the diploid space to the dural venous sinuses.
very good. If you can wait. Yes, just a second. If I can remove this. Sorry. I'm not wasn't supposed. Okay, if you can look at this image and can you please identify what these numberings are pointing at? What are these?
Yes, ma'am. Okay. One is confluence of sinuses.
Just tell me what these blue things that you're
These
looking
are
at.
dural. These
Dural
are
sinus.
dural venous sinuses, ma'am.
Yes. First, can you please tell me how many dural venous sinuses there are?
There are four unpaired and six paired.
Six paired. Okay. Can you name the paired ones first?
Paired ones are cavernous sinus, transverse sinus, sigmoid sinus, sphenoparietal sinus, superior petrosal sinus, and inferior petrosal sinus.
Okay. Now, can you please name the unpaired ones?
Unpaired ones are the superior sagittal sinus, inferior
Yes.
sagittal sinus, straight sinus, and occipital sinus.
Can you look at in this image and try to identify superior sagittal sinus and tell me from where to where it's found or it's connected or how it runs?
Superior sagittal sinus runs along the attached border of the falx cerebri from anterior to posterior and
Yes.
joins the confluence of sinuses.
Okay. And which one would be the inferior sagittal sinus in this image?
It would be number 3.
Okay, we'll come back to the solution later. Can you tell me
Okay.
why the sigmoid sinus is called sigmoid sinus and which one is
Because
it?
of its shape, ma'am.
Yes, very good. It has
Number 4 is sigmoid
all
sinus.
right. Where exactly is it located?
It's located in the floor of posterior
Posterior cranial
fossa.
fossa. Very good. Okay. Yes. If you can tell me which one would be the sphenoparietal.
Sphenoparietal is number 8.
All right. Good. Now, if you can tell me, yes, what else I could have asked you? How is the flow in these venous sinuses, dural venous sinuses?
From the superior sagittal sinus, the venous drain happens to the confluence of sinus. From the
Yes,
inferior sagittal sinus, it joins the great cerebral vein to form the straight sinus to the confluence of sinus.
yes.
From the confluence of sinus, the transverse sinus originates and goes transversely which joins with the superior petrosal sinus to form the sigmoid sinus, which later joins the inferior petrosal sinus to form the internal jugular vein.
Yes.
And the sphenoparietal sinus drains to cavernous sinus, which later drains to the superior inferior petrosal sinus.
Right. Okay. What happens? Can you tell me how the flow of CSF is formed?
CSF is formed from the choroid plexus,
Yes.
from
Which are
the
located where? Yes.
in the lateral ventricles.
Yes.
From there, through the interventricular foramen of Monro, it
Yes.
reaches the third ventricle. From there, through the cerebral aqueduct, it reaches the fourth ventricle.
Yes.
And from there, through the lateral apertures and medial apertures, foramen of Magenti and foramen of Leschka, it
Yes.
reaches the subarachnoid space. And in the subarachnoid space, it circulates and later reabsorbed through the venous arachnoid projections
Projections.
into the superior sagittal.
Good. Can you tell me what you understand by the term cavernous sinus?
Cavernous sinus is a paired venous sinus located in the either side of cella turcica. It
Yes.
drains the ophthalmic vein, uh, facial vein, sphenoparietal sinus, and emissary veins,
Yes.
and it drains into the superior inferior petrous sinus and internal jugular vein.
All right. Can you tell me in what conditions the patient can have cavernous sinus thrombosis?
It usually happens with the infection in the dangerous area of face,
Yes.
where the veins are valvulus and infection can transfer
Yes.
from the facial vein to the superior ophthalmic vein to the cavernous sinus, and thrombosis can cause
Occur.
paralysis of the nerves adjacent to the cavernous sinus.
So, what are the clinical features? How would a patient present when suffering from cavernous sinus thrombosis?
Patient will have headache, periorbital edema,
Yes.
proptosis,
Yes.
diplopia,
Yes.
and later loss of vision.
So, what are the risk factors which should be avoided? Can you name few risk factors?
Risk factors to avoid what?
To avoid cavernous sinus thrombosis, there could be nasal furuncle, there could be dental infection, because the dangerous area of the face. Think of more.
Okay.
What more could be there? There could be a
Sinusitis,
yes, tonsillitis, soft palate
tonsil.
infection, or orbital cellulitis, could be middle ear infection. What else
Okay,
could
ma'am.
be? Paranasal sinuses. Okay. All right. So how should that be managed?
Those should be managed with the antibiotics.
All right. Or according to the NHS guidelines, we'll give the
Okay. Okay.
All right. Okay. What more I can ask you? What is optic chiasma?
Optic asthma is the crossing of optic nerves that occurs anterior to the cella turcica, where the inner parts of the optic nerves crosses to the opposite side, while the temporal side will continue posteriorly
Yes.
without crossing.
Okay. Very good. One last question. What could be the mechanism of papilledema?
Papilledema occurs because the optic nerve has a meningeal covering along its uh, supply to the eye.
Yes.
So when the CSF pressure increases, there will be uh, compression and stasis. Also, there will be the disruption of the axonal supply, which can also contribute to papilledema.
Okay. So there's increase in pressure, which is
Yes,
transmitted
ma'am.
through the optic nerve, and this optic nerve sheath, which is continuous with the subarachnoid space of the brain. That
Okay.
good. Excellent. Thank you.
Thank you,
Now
ma'am.
we can have a look at the answers that you were giving me. So 8 was which one? This one. Sphenoparietal sinus, yes. And I asked you about the superior sagittal sinus. This one.
Okay.
Straight sinus is this one, 2. And then 3 is great cerebral vein. And this one is inferior sagittal sinus. Yes.
Okay.
And then 4th one is sigmoid sinus. This one, sigmoid, yes. 5 is inferior petrosal sinus. And 6 is this one, superior petrosal sinus. 7 is here, this one, cavernous. Here. Yes. And then 8, you already know. Good. Right. Good. Thank you.
Thank you.
Thank you.